Beautiful guest, Dr. Melanie Rosenblatt. Hi, welcome.
Hi, thank you.
Welcome, and I'm going to share this, and I recommend that you share it as well. I'm going to make this public so that you can share as much as you possibly can with family and friends, because we are going to be educated this evening on things that I know very little about, and I'm sure family and friends don't know much about if they're not struggling with addiction themselves, or have someone that maybe has not even known that there are alternatives in this type of medicine. So I'm going to share this. I recommend that you all do this as well. This is so educationally sound. And let's see here. Where am I live? Here we go. Okay, so I'm going to turn my volume down, and I'm going to share us. You look so pretty on camera. Live.
Oh, look at us.
Yay! And then I'm going to share this to every group in South Florida that I belong to, which is a lot. Wellington Moms Group, Social Girls in Miami. Okay. Yay.
This is my first ever Facebook
This is really?
pod. Yeah.
This is so fun. Let's see here. All right, guys, we're getting set. So if you are interested in learning about alternate forms of pain management other than traditionally what you think of and what has just devastated the country with the opioid epidemic, you're going to want to watch this. So here we are. Dr. Melanie Rosenblatt, you come highly recommended by our mutual friend, David Lopez, who I love. To start this off, we're going to start this off on a fun note. We have both been asked to have a movie role in David Lopez's movie called West Side Haven, which is a biography, really, right, of his life growing up in New York. Very, very interesting. You are going to play
The casino manager.
which is awesome. I am going to play, I think, a radio host in some capacity.
How fitting.
How fitting, right? So we're both tied together that way, and this subject came up, how fitting, especially because as a lot of you watched my cousin yesterday evening really open up and talk about his struggle with opioid addiction, homelessness, prostitution, and so forth. So if you're watching and you have any question in your mind about alternate forms of pain management, this is who you want to talk to. So I'm going to open the floor. How did you get into this field?
Well, so how I got into medicine is its own story, but as a medical student, I first went into OBGYN, which was really fun, like lots of drama and lots of great science and lots of really helping women and babies. I mean, how cute is that? And I did a year of my OB residency, and then I decided that I liked my life and my bed more than I liked delivering other people's babies, and I wanted my own. And so I found my way into anesthesia, which was a great, really fun, really high-tech specialty. Very hands-on, lots of procedures, helped a lot of people. My best friends I made there were when I gave labor epidurals.
Oh, yeah.
To whom women out of pain was a good thing. Like, oh, honey, I wanted to go natural. I'm like, this is natural.
This is great.
And from anesthesia, spending a lot of time in labor and delivery, because that's where I was very comfortable, babies and all, and watching the fetal tracings and understanding what happens during labor. I got very good and very quick at those procedures, spinals and epidurals, most women have heard about. So that was really my first intro to procedures. And then part of a subspecialty of anesthesia is in fact pain management, where we learned how to do all kinds of injections to basically create anesthesia or take away pain for a part of the body. So we do that, before surgery for surgical procedures. We do it after surgeries for pain that you wouldn't know existed, and most of your viewers have never heard of unless they're suffering from some horrible, painful disease. So as a pain specialist, I treat all kinds of pain, from cancer pain to incidental pain. I'm on staff at 3 hospitals. I do pain consults. I treat post-operative pain. I treat all kinds of post-surgical pain. People coming into the emergency room with not knowing what their abdominal pain is coming from for all kinds of reasons, including people with addiction who come into the hospital because they ran out of their medications, or they've got an abscess on their arm from shooting up medications or heroin. And so I see all kinds.
When you take me through the years when people were prescribing those heavy opioid drugs for pain management.
So back in 2012, we had more McDonald's in Broward County than we had more pain clinics in Broward County than we had McDonald's. We had a lot of pain clinics. And that was at a time when I had started working with, I'd started a few years before, but working with the DEA, local law enforcement, to help identify and shut down some of these pill mills. And then Florida legislation sort of caught up and helped, and they were able to make pain clinics register, and they were able to shut down a lot of the pain clinics. We were talking earlier before this started tonight, and no, they're not all gone. They just look a little different.
Interesting.
But it's still going on, yeah.
Interesting. They're still prescribing things like methadone and all of...
Yes. So methadone is prescribed for pain. Methadone is also prescribed for treatment of opioid use disorder or to treat addiction. And when it's used to treat addiction, it must be given in a treatment center, like the methadone clinics that you've heard of.
Interesting.
Seen.
Okay. So I'm looking, if you have pain, and I know I'm coming to you at some point because this pain has been debilitating that I've had in my hip, and I went through so many doctors trying to identify the pain, and everything was correct with me, so they couldn't diagnose anything. They thought it was my appendix. They thought it could have been a procedure that... Anyway, I went down a rabbit hole of go to this doctor, go to this doctor, this was years ago. Now I have phantom pain, and now it like flares up, so to speak, every now and then, and so it's debilitating pain. Tylenol doesn't work. If I come to you, there's a number of things that you could do. Take me through some of these, because medical marijuana obviously is widely popular in the state of Florida. Do you do things like what Trulieve does, or what some of those local dispensaries do? Do you prescribe?
Right. So as a medical marijuana provider, a physician, I'm registered with the state to be able to provide and educate patients on the use of medical marijuana. So really, you get a recommendation.
Okay.
So I don't dispense it. I don't even really tell you what to get. I send you to the very reputable. You mentioned Trulieve. There's many like that. And the dispensaries, they really are on their game. They know what they're doing.
They do.
And what I find, my patients tell me, a lot of people it really helps. A lot of people it doesn't. And then there's different strains. So at the counter there, at the dispensary, they're quite knowledgeable on what you really need, whether it's more for sleep or anxiety or pain.
Interesting. Yeah. And then there's medication management that you have. So what does that consist of? That's interesting to me. Yeah. Medication management.
So medication A to Z, really. You were alluding to opioids or pain pills, and so there's definitely a role for pain medication in chronic pain management when it's used judiciously and appropriately and closely monitored.
Okay. And then detox.
So when patients are addicted to opioids or have opioid use disorder, detox is something we can do in the office.
Interesting. Okay.
And so
overnight, inpatient type of thing?
Outpatient.
Really?
Yes.
Explain that. That's interesting. Explain that.
So there's a medication called Suboxone, which is buprenorphine, which is a Schedule III opioid that is used for the treatment of opioid use disorder. And so the process is when you come in, and this is all prepared ahead of time, and you're all ready to go. When you come in the morning, you now haven't had any opioids, you haven't had your pain pills, or you haven't had heroin, or whatever is your opioid that you're using. And you come in withdrawal, mild, moderate, or severe withdrawal. It works better if you're in moderate or severe withdrawal. And so what withdrawal looks like, opioids, is, you're familiar, and I'm sure you heard from your cousin yesterday. Think everything leaks. So it's like having the worst flu of your life. Your nose is running, your eyes are tearing, you're vomiting, you have diarrhea, you're sweating, you have goosebump flesh, abdominal pain, aches and pains all over, the worst will of your life. And so when you're in withdrawal and you take this sublingual medication, Suboxone, within 10 to 20 minutes, those symptoms go away completely.
That
It's
is,
life-changing.
and why don't people know about this more? I've never heard of this before.
So in order to prescribe Suboxone, you need to have a waiver on your DEA license, which I have, and many providers have it. It's that now. It used to be an 8-hour training course. Now it's a 2-hour course online. And you can take this course and get a waiver on your DEA and be able to prescribe it for outpatient treatment of opioid use disorder. And we can give patients a 30-day supply, and I see my patients monthly. Unlike methadone, we talked about before we went live, that you have to go to the methadone treatment center every day. So Suboxone, rather than going and getting online at 5 a.m. and then going to work, you can have a whole month's supply. And the reason for that is, well, one, it's got naloxone in it, so it makes it harder to abuse. But two, buprenorphine has a ceiling effect on respiratory depression, so you're not likely to die of respiratory depression, which is how opioids cause death. Buprenorphine has a ceiling effect on opioid depression, so unless you're mixing it with other respiratory and sedatives, other medications that can cause a depression in your respiration, like benzos or alcohol, as long as you're not combining it, your chances of having a respiratory depression are mitigated.
This is so interesting. So we were talking a little bit about this too. There are great treatment centers, and then there are horrible places that are just not even, they're just not reputable, and they have a bad reputation and things like that. So if someone went to a good treatment center, would they be able to provide that as a treatment? Was it Suboxone?
Many treatment centers do offer Suboxone as a treatment, yes. But many of the halfway houses, when patients leave, don't allow it. So a lot of them, what they do is it's a taper program. So they come in and they do an induction, which is what we call when you first start detox. They do the induction, and then they put patients, typically they put them on a taper for Suboxone, and then they're weaned off.
And so what happens to the patient?
Well, that depends. That depends on where they are, right? So there's a lot of bad programs out there that might, for example, intentionally help somebody relapse, and then they go back into the 30-day program, right?
Then they're in that cycle, the
Right.
pain money cycle, getting well, then falling back. That's so sad.
So in my practice, I have a lot of patients that I met when they were in the hospital and they had, opioid use disorder that was either undiagnosed or they weren't necessarily even looking for treatment or help. But when I met them in the hospital, rather than that revolving door of people coming to the hospital, they, like your cousin, might fake symptoms to try to get opioids. And through a very measured process, I helped sort that out. And I have a lot of patients in my practice who I met when they were in the hospital, not even looking for treatment, but lucky enough, you might say. Sometimes they felt unlucky.
Interesting.
They'll be at 3 different hospitals, like, oh crap, you're here too, and you're at the other hospital also. I'm like, yeah, I'm like a bad penny. I'm going to keep coming back because I really want to help you. And so I have these people in my practice that I started on Suboxone that are still on Suboxone. I do something else to tell you about, though.
Tell me.
I'm the chief medical officer of a company we haven't talked about called iRecovery. And
Ooh,
that's an all online.
Tell me about iRecovery.
That's a telehealth platform that Dr. Zipper is a colleague of mine, Jeffrey Zipper. He launched this and approached me, so I'm now his CMO. But that is a total online telehealth platform where we can start Suboxone in your home. We're not there. It's all virtual telehealth. Telehealth became wildly popular during COVID.
Wildly popular. Teladoc, all
Right.
those companies have been,
And so we not only can do Suboxone, but we treat all kinds of substance use disorders, including alcohol abuse, opioid abuse, and we have psychiatrists and psychologists on our staff also. So patients are getting group therapy and one-on-one therapy.
That
and
is
social
amazing.
services. It is amazing.
And it's called iRecovery.
Little I Recovery.
Little I Recovery, and the website is at iRecovery.com or
iRecoveryUSA.com.
iRecoveryUSA.com.
It's amazing. I'm really proud to be a part of that.
How long has that been in existence for?
Just over a year. Yeah.
How brilliant is that? Because like you said, with telemedicine sweeping the nation, for mental health, you have Headspace, you have Talkspace for mental. You also have there's patients with chronic pain that specifically for maybe cancer or diabetes that do monitoring and have an app and things like that. I've seen it all.
Right.
Looking at research for Drew's show, but this is really interesting, and I'm assuming wildly successful at this point because it doesn't seem like there's anything like it in this space.
Right.
Wow. And I mean, granted, it's virtual, but in South Florida, I'm sure that inspired you to do that because I'm sure you've seen it all. So, really interesting. iRecoveryUSA.com. Oh, good. MacGyver typed it in the comments, so that's good. Hi, David Lopez. David's watching.
Hi, David.
We opened the show talking about Westside Haven and how she's going to be the gorgeous casino manager and that I'm going to play myself basically as a radio host, and how we're super excited to be a part of your film. Westside Haven, if you all will be seeing it all over the internet shortly. David's been trickling in different pictures and things like that, but the promos will definitely start. This is really interesting. So this I can barely pronounce. Was it kyphoplasty?
Very good.
Oh, yes! So kyphoplasty.
Kyphoplasty.
What is that?
Maybe one. I mean, I do so many cool things, but this is actually one of my favorite. Ooh. What happens is as we age, our bones get soft, right? Not just women, but men also. And when you're a little bit older, 90 is the new 60 in South Florida, right?
Yes.
But as we age, our bones weaken, you can get what's called an osteoporotic compression fracture. And that's why people tend to hunch forward as they age, because as we compress, the load's in the front, and as it heals, it's sort of wedged, and so we kind of lean forward as that happens, right? But sometimes it happens, it's acute. Somebody might just have a ground level fall, slip in the bathroom or the bedroom, and it's not like a young person trauma where there's a healthy bone that's broken, then you go in and surgically fix it or cast it. This is soft bone. And it's very prone to compression fractures. So the normal height of a vertebral body, the backbones in your spine from your neck all the way down to your tailbone are that big, and as they age, they kind of compress. But if you have a trauma, even a mild trauma, you can have a sudden collapse, and that's very painful. And so what a kyphoplasty is I go in under like twilight anesthesia usually, and put a needle into that bone, and then through that needle inflate a balloon. Ooh. And that balloon compresses and compacts the bone around it, and it restores the height.
Interesting.
And then we mix up liquid cement and then deflate the bone and inject cement, and the liquid cement fills up that void, and then it stays. And instantly these patients get off the fluoroscopy table and their pain is essentially gone that quick. It's amazing. So much fun. So rewarding.
I've never heard of that before. That makes so much sense. Are most of these, I see there's some insurance providers, are a lot of these covered? Like these chronic, these are interesting. Okay, that's good to know. Good to know. And then spinal cord stimulator. This is interesting.
That's my baby.
Yay! Tell me about it.
I guess everything's my favorite, but I get really excited about spinal cord stimulation because it's, people who reach the point of spinal cord stimulation have usually tried and failed everything. And they're like, I'm in terrible pain, nothing else works. I've already had 12 back surgeries. My back and legs are killing me. Nothing else works. And when I tell them about this, it doesn't make a lot of sense the first time you hear it. But basically, it's like a labor epidural where the catheter goes into your back. And,
okay.
Most women anyway know what that is. Men too. But instead of delivering local anesthetic or a drug, it delivers electricity. And this electricity, or this current, this vibration, that depending on which company and what the settings are, it might even be sub-threshold that you wouldn't even feel it. But it causes a sensation in the spinal cord that distracts the spinal cord from transmitting its pain signal. So, like some of the companies call it a pacemaker for pain.
Interesting.
Really cool. And the best part is, you never know how things are going to work, but you can take this for a test drive. right? So, for example, you mentioned that your hip might hurt and maybe you need a hip replacement and you're far too young. But imagine going in for hip replacement and your pain didn't go away. And you're like, you know what, my old hip was just fine, and after the fact, I wish I hadn't had the hip surgery. Or some people have back surgery and they don't get better. In fact, some people are worse after surgery. So with this spinal cord stimulator trial, I put it in under local anesthetic in the office, float it up to where it needs to be, and sort of in the mid-thoracic spine, and externally plug it into a little battery, wear it in a belt, and try it for a week.
That is so neat.
And so patients come back after that for the lead pull a few days later or up to a week later, and they're like, oh my God, that was the best week of my life. My pain is 80% better. How soon can I get this implanted? Or they're like, you know what? It didn't really help me all that much. I'm like, okay, we're done. Pull it out. It's that simple.
It's a trial.
It's a trial. And then the permanent, if we decide to go permanent, is an implant done in an operating room. There's a battery that is, about that big, and it's like a small pacemaker, and that gets implanted under the skin, and the wires, everything's under the skin, and it's rechargeable or not rechargeable. It lasts 7 to 9 years depending on the system.
That was going to be my second question on how long that would last, and because what's the like if you wanted to get it replaced after 7 years, you have to extract the whole thing and then
No, just the battery.
just the battery. So it's automatic once it goes in permanently.
The wires are all there; they stay unless they migrate for any reason. But it's great for you mentioned phantom pain. It's great for phantom pain. It's great for complex regional pain syndrome. It's great for post-laminectomy syndrome, which some people call failed back surgery, but spine surgeons don't like that name, so it's post-laminectomy syndrome.
Surgeons don't like that name.
And it's good for headaches. It's good for lots of things. And one of the companies, Nevro, has a high-frequency stimulation, Nevro, Nevro, that just got approved for diabetic peripheral neuropathy, or peripheral diabetic neuropathic pain.
That makes my heart. My dad had awful neuropathy, diabetic. I mean, losing limbs, had amputations.
Whole world of people we can now offer therapy to.
Unbelievable.
Right. It's amazing. It's really, and that just happened like 2 weeks ago. They just got FDA approved for that, so that's very exciting.
Why aren't we hearing this on the new? I mean, am I missing something? Is there been a press release? Is anyone talking about this?
Yeah, there's press release, but
okay.
Why would it necessarily reach you? But people come to my practice all the time and they're like, how come I've never heard of this? Is this something new? I got to tell you, spinal cord stimulation has been around since I was in training, which was a really long time ago.
So I feel
like a really long time ago now.
Wow.
In the early 90s I was trained on this. This is not new. I mean, Jerry Lewis had a spinal cord stimulator, if you think back that far.
So people, I think, they just think that this is too complicated, all of this, and decide that maybe they just want to take pills because it's the easier way to do it.
Maybe. So you're getting
rather than the most effective, but they think in their mind,
right.
even though it doesn't, it may not really work as effectively, but
right. But there are also different risks and benefits and different side effects, and you can understand the reluctance of people who have been on pain medicine and want to stay on pain medicine, and they don't really want any other interventions, and as their options narrow down, right? So I meet a lot of people who come to me as a new patient, especially as the pill mill shut down, and still there's so much pain out there. There's so much pain. It's devastating. So people come to me, looking for solutions. Some of them already have preconceived notions of what they want, what they expect, and so I spend a lot of time educating that pain pills aren't necessarily the way to go, that there are side effects, that it's not for everybody, that there are risks of abuse and addiction, and we take that very seriously.
I don't know what I'd want. I mean, what would you recommend for my hip?
It sounds like you need a hip injection. I'm not filing HIPAA because you're not my patient.
It's right? So, I mean, I need to go and see. Literally, this pain, it goes from my back all the way to it's awful. And I'm thinking to myself, do I have osteoporosis? Do I have, my organs are fine. Everything's been checked. I've gone to everyone. You're fine. And a dear friend of mine actually has been going through something where she is in severe pain. She's a personal trainer in her 50s, in the best shape of her life. I mean, healthiest person I know, bar none. Just the healthiest person I know. For the last 3 months, has literally not been able to get out of bed. And not been, some kind of under the rib. She has gone to everyone. No one can figure it out. you're fine. You're fine. Now she's going down the rabbit hole that I'm going
Right.
through. I would love to recommend her to you because she, at this point, she doesn't know. She doesn't know.
Well, that's probably the hardest thing about pain is I have a lot of patients who they don't necessarily even have a true diagnosis. They're just in pain. And some of the, the autoimmune diseases and some of the just fibromyalgia,
Lupus, things like
lupus,
that.
autoimmune, small fiber neuropathy. There's pain that you can't see because it doesn't show up like a broken bone does. And we don't have a painometer to prove how much pain you're actually having.
Because the nerves, everyone's different. Everyone's body's different.
Right,
It's insane. If I wore heels, I wouldn't be able to walk the next day.
Think about like headaches. You have a normal brain scan, a normal MRI, but you've got these horrible headaches. We can't find anything physically wrong. So what do we do? Trial and error with medication, trial and error with procedures. There's a lot of interventional procedures. And
What can you do for migraines? Just out of curiosity, because I've struggled with those too my whole life. I'm sitting here like, wow, this is
how much time do we have?
right? This is like a whole consultation. I mean, honestly, chronic migraines, MRIs, CAT scans, the whole gamut.
Right. So a lot of people with headaches, don't really know. They may have been told at one point they're migraines, but they might not be. It might be cervicogenic headaches. Sometimes, degenerative changes or herniated discs in the cervical spine can cause those kind of pains. Occipital neuralgia. There's a lot of things.
So interesting. Come see Melanie Rosenblatt. I am definitely going because she needs to block her day. She's gonna have her hands full. And then what else was I looking at? Oh, was it BioT? Did we talk about that?
We didn't. That's bioidentical hormones. Those are the pellets that help with testosterone and
Explain that a little bit, because I think I heard some people I know are 50-50, and then other people don't know anything about it. So some people are all about it. Some people are like, I don't really know much, and then...
and it's sort of, somewhat controversial, and it's sort of a little more like integrative medicine. I enjoy it, and the reason I brought it to my practice, frankly, is I became a patient. I was having hot flashes. I went through menopause. I was miserable. Covers are on, covers are off, the AC's up, the AC's down. I've got a teenage son laughing at me, right?
You're sticking your head in the freezer wanting to get cooled
It's
off.
miserable. And then so finally, with trial and error and the patches and the creams and everything, I found my way to a BioT training. I was like, this is amazing. And I just found my hot flashes went away, my energy got better, my recall got better, my patience got better, my mood got better, my patience, not my patience.
Right.
I brought it to my patients.
There you go.
I pelleted my mom, and she said her mahjong game got better and her tennis game. It's great. It's great stuff.
All of these, it's like eeny, meeny, miny, mo. All of these sound great. Like, honest to God, like this is
what I consider my toolbox.
That's exactly what this is. This is, and then of course the injections are they cortisone or?
Often. Usually.
What other types of injections would you give for pain?
Local anesthetic, steroid.
What's a block?
A block is just a general term for blocking the pain sensation. So in general, we think local anesthetic, steroid can make it last longer. But then we can also do things like burn the nerves. So there are some nerves that we can do that with and that are very amenable. So the lumbar facet nerves in your back, those nerves, I think of it like your appendix. They can only cause aggravation. They're purely sensory and they can cause maddening pain. So we test it with local anesthetic, with or without steroid. And if the pain gets better for a short period of time, we can go back in and burn those nerves. Also done through the needle. It's called radiofrequency. It's also called a rhizotomy. You can also do that for the nerves of the knee. It's called genicular nerves. There's a lot of nerves that we can do that with. If they're only causing you pain, look for a way to heal it.
Who knew? You have been in South Florida for quite some time. It started in New York, correct?
I did my training, my education and training in New York. I went to Stony Brook. I trained in Syracuse. And when I finished my training in Syracuse, I had enough snow. And so I moved down here. That was 1995. I followed my parents down here.
Unbelievable. And you have, I mean, I'm looking through your resume. It's just it's unbelievable. What's the next step for you? I mean, you've done so much, and at this point, do you want the telehealth company to take off? Do you want to continue opening more locations for your practices? Like, what's next for you?
Not opening more locations.
Okay.
That's too much work. I'm very happy where I am. I want iRecovery to take off. I think that's amazing, and I'm proud to be a part of that. And it will take off. We're branching out into other states now also. That's the next step. So it's going to be amazing. But really what I'm doing a lot of now, and I'm looking forward to doing more of this, is consulting. So I told you that I work with the DEA and the FBI, and I review medical records for hospitals, for health systems, to make sure that their opioid prescribing is in line with the current law. So I get hired as a consultant to just review, to check, and in some cases to help prosecute. I'm also working in the opioid litigation, the national opioid litigation, as Teva Pharmaceuticals medical expert. And so we're currently in court in New York. I'll be flying up there next week for that. California just ended. We already did Oklahoma and Ohio. Rhode Island's coming up. Florida's coming up. And so in my work as an expert with them, I get to read so much and learn so much. And the states have different nuances. They're all a little bit different. And
I would imagine very interesting from state to state.
It's very interesting. And just working with these brilliant legal teams on both sides, it's really fascinating. It's complicated, right? Because we know that opioids can cause harm. And we know that opioids are so important as a therapy to help people in pain, but they're not without risk.
It's unimaginable when in the wrong hands, what it can do, and how pain management can drastically be improved, if not alleviated completely, in the right way, without some of those things that people have traditionally thought of for so many years. I am going to come to you immediately. I'm like, wow, this is... Any comments we've got? Oh, we've got everyone. We've got David still watching. She is amazing, David. You are absolutely correct. Correct. I'm going to talk to you about so many other things off the show, off topic, because I just want to pick your brain about the telehealth that you're doing, the iRecovery. But all of these things, you have 2 locations. If you want to tell everyone that's watching, I mean, they can go to your website and put that on there, but where are your locations? And
I have an office in Deerfield on Hillsborough Boulevard and an office in Boca Raton on Military Trail.
Oh, that's close to me. Okay, that's not too far. And what would you tell people, especially in South Florida, what would you want to say to them to maybe think of alternatives in traditional, let's say, the opioid world, pain meds, to come to you? What would you like to say so they understand there's different alternatives?
Pain is horrible. Pain is devastating, and it doesn't have to be. There are some really good treatments out there. Every situation is unique. Every case is different. Wherever you're watching this, find a good pain provider near you. I mean, you're not just here, right? We're talking to people everywhere, right?
That's right.
Not just locally. But it just makes me sad when I meet people who have been managing their lives a certain way for so long, and they say, I wish I'd met you sooner. Whether it's because they've been doped up on way too many opioids for too long and I helped get them off because they knew no other way, or they've been just suffering with their pain and didn't know things like spinal cord stimulation could change their life.
Wow.
So it really is, I find it incredibly rewarding. The kyphoplasty is more of a fast thing. They come in, they break their back, and we fix that. So that's not even really chronic pain. But all the other things are chronic.
Unbelievable. You've also done some television, some film in the past. Discovery Channel, Pain Matters. Was that a series that?
No, that was a 1-hour documentary on the Discovery Channel.
So neat.
Really amazing, yeah.
So neat. And you did a satellite media tour in San Francisco, September 2014. Discovery Health Channel, May of 2015. And so I can't wait to see what you do next. I'm so excited, and I will be calling you now that I have health insurance for the first time in a while. I will be coming to see you because living with chronic pain is debilitating, and I had no idea that there was all of this available. I really had no idea. I had known what friends of mine had done for years, and that was they would always say, oh, I'm going, to get a block, or going for a steroid injection, or for a cortisone injection. But that's the only thing that I knew. I didn't know there was other options. So if you're watching, there are a ton of options. I mean, just go to the website. This is rosenblattmd.com. You will find a plethora of information that, like myself, I had no clue, no concept. I'm 39 years old. I've been living with chronic pain for several years. You can be any age and have pain and go see Dr. Rosenblatt and have her assess you and see what's going on. This is truly fascinating. I am so glad that you came on tonight, and I can't wait to share this. Please share this. Wonderful things to come, and I can't wait to be on a movie set with you. All right, guys, thank you for tuning in to Skulls and Stilettos, and share this video immediately. Bye, guys. Till next time. Thank you so much, Dr.